Good afternoon. My name is Scott McLennan. I'm the Executive Director of the Global Mountain Fund, and I'm coming to you today from Kathmandu, Nepal. In Nepal, we're in the midst of a medical and humanitarian crisis on a scale that's absolutely epic. Now, you've probably heard about the coronavirus and the rampage through India and what's happening in India. But as a percentage of the population, the coronavirus problem is actually worse in Nepal than it is in India. Add to the fact that Nepal is one of the least developed countries on earth. Its medical infrastructure was totally unprepared for the onslaught of cases. People that were working in India came fleeing across the border, which is an open border for hundreds of miles with India, back into Nepal when the whole second wave started, bringing back with them what's called the Indian variant of the coronavirus, which is now spreading at a rapid rate throughout the population of Nepal. The hospital system is completely overwhelmed and broken down. It can't keep pace with what's happening here. The number one problem facing the hospital system is a lack of oxygen. People are dying every day because there isn't enough oxygen. Hospital beds are sitting empty because the hospitals can't admit patients unless they can supply them with crucial life-saving oxygen. The capacity of this country to produce cylinders of oxygen, medical-grade oxygen, is only about 8,000 cylinders a day. Today, the demand for cylinders is 15,000 and rising. There simply is not enough capacity to produce the medical-grade oxygen to keep pace with the need, and the need is getting greater by the day. Our plan is to purchase an oxygen plant, which will make medical-grade oxygen, and to put that at a 100-bed hospital located in Kathmandu. Now, this is a hospital we've had a 15-year-long relationship with. We know these people well. We know that the oxygen plant will be well maintained, well cared for, and it will be used for the purpose that it's intended to be used for. You know, every day people are dying in the hospital corridors waiting for a bed with oxygen. The social media feeds here from Nepal are filled with people begging for oxygen, asking the question, does anybody know where there's oxygen? What hospital can I take my mother, my father, my children? It's a crisis situation, but we can make it better. We can get an oxygen plant. We can start producing our own oxygen for this hospital. And the oxygen now being used by that hospital can go and be allocated to another hospital. So hundreds of patients every month conceivably can be saved by your help and your donation today. The second crisis we're facing here is a humanitarian crisis related to food. Since this pandemic second wave began, businesses all over Nepal have been closed, and they remain closed. We're in what's called lockdown. This has impacted women at a greater rate than it has men. One report I saw the other day said it's about 2 women who've lost a job for every man who's lost a job. So they don't have the money to buy food. They don't have the money to pay for groceries. These were women who primarily were working as what are called day laborers, cleaning houses, doing childcare, domestic work like that for which they would be paid each day for their labor. But since everything is closed, they're no longer working. They're not able to earn a living. They're not able to feed their children. Many of them will go to bed hungry tonight. Working with local volunteer youth groups, we've been helping to procure and distribute food to the most needy people in Nepal. I need your help. Nepal needs your help. Hundreds, if not thousands, of lives are at stake. This problem is only going to get worse in the coming months, and we're already underwater and unable to save lives for the lack of a few simple things like oxygen and food. I want to reach out to you today and ask for your support and ask for your help. And I thank you so much. And the people of Nepal thank you. Your help is going to save lives. And there's just not any way we can possibly thank you enough for that. Namaste, and God bless you. Have a great day.